Hello and welcome to the Doctor's Corner. I'm your host as always, Dr. Mark Pinsky, and today, more weight loss success stories. Joining me today is Kenda Maloney.
Hello.
Thanks for being on the show. Thanks for taking time out. You're a busy woman. I appreciate you. Thanks for coming. So we're going to ask you a couple of questions about the Pinsky Weight Loss Program.
Okay.
And I know some of the answers, but they don't. So that's how we're going to do it. All right?
All right.
So first of all, how'd you hear about the program?
Through your medical practice. I love my doctor.
I love hearing that. So Kenda has been my patient now for what?
A
couple years? Okay,
3
years. And so obviously through being in the office, you heard about the weight loss program. Mm-hmm. And what convinced you that that should be something I should try?
I felt like I had tried everything else with no success. And so I was like, all right, let's give this a go.
All right. So tell me about the things. You don't have to name specifically the programs. That's okay. But specifically, what do you think led to the failure of those programs?
My personal opinion is that I didn't fit the mass mold, right? This is what, if everybody does this, they'll lose weight. And all those little things that I tried, like, well, this works for everybody, and this works for everybody, and this works for everybody. I'm apparently not everybody, because none of those worked. So I was like, whoa, I was terribly frustrated. So
okay, so that leads me into my next question. Thank you. What specifically about our program do you think really led to some of your success?
I think there are a lot of things, but I do feel like it's more of a whole person program, and not only a whole person program, but also a program that deals with your body, not, again, that whole masses thing. And that was, I think, huge for me.
Right.
Huge.
So we're going to get to that a little bit because Kenda's very unique in her approach to the weight loss program, which is why she's here. One of the things we've talked about before on the show is how I customize the program. Mm-hmm. And that's what Kenda's getting to. Most of the other programs are really cookie cutter programs. And those programs literally tell you what to do and you're supposed to follow along. Mm-hmm. But we don't do that, as you know. We give you guidelines and we give you some structure, but we allow you some free reign to allow yourself to explore exactly what you think will work for you. And I think that's what you're really getting at.
Absolutely.
All right. So let's talk about that because that is what intrigues me the most. So what I want you to do, as best as only Kenda can do, because it took me a long time to understand Kenda's approach. Tell me how you made this program your own.
Okay, let's see. Let's try to sum that up. First of all, I'm not a big fruits and vegetables fan, but I know that you need those, and I know they're part of a healthy lifestyle. So for years and years, I've been doing a smoothie, and I put all my fruits and vegetables in a smoothie, and I dehydrate my vegetables and I turn them into a powder, and that makes it easier. So I just have this whole process. And so that was one thing that I really liked about the program, that I know that I need to get my fruits and vegetables, and I had a way to do that, and I had the freedom to do that and made it work. So.
And let me tell you, this is the most unique approach I've ever seen, and it worked like a champ, like an absolute champ. So one of the things we do is we use high quality shakes that have been scientifically derived. So Kenda took those shakes, incorporated her own philosophy into using those shakes, and that's what she's talking about, her fruits and vegetables, right?
Mm-hmm, mm-hmm.
Okay.
Yep.
So we love that, but there's other things that you did. And by the way, how much weight are we down now?
About 60 pounds.
Yes, woohoo. 60 pounds. And in the 20 weeks, you were down how many by the end of 20 weeks?
Well, let's see. So 20, so 40, so almost 50 pounds, I think.
Right. So we've just got a little past that. And Ken is now a part of the maintenance plan, part of the program. And so she's down 50 pounds. We strive for 2 to 3 pounds a week. So of course she was right in that range of what we look for. Mm-hmm. And to be very frank with you, a lot of that is just you figuring out with, again, me giving you guidelines. So people talk about exercise all the time and how important exercise is. And I'd say that too, because of how important it is, not just for weight loss, right? But how important it is just for overall health and wellness. So tell me what you did, and there's a reason I'm asking this question, what you did through the program so that we can talk about an activity in the program.
Well, I have a friend that's a personal trainer and knows me, and I'm grateful for that. So I did have her help, but I think what you're possibly alluding to is I just have some other physical health issues like fibromyalgia and stuff. And so one thing that was really cool about this program is I did try to be active, stay active. I'm still figuring out the things that will and won't work for me, but I had flexibility there when I was down but could still lose weight.
Perfect. So what she's really hinting at is people who have chronic diseases who can't necessarily exercise the way I exercise doesn't mean it hampers their weight loss.
Right.
And one of the things I tell patients all the time is that I don't necessarily want you to exercise just to lose weight, because you really don't need to exercise to lose weight. But the goal is to try to get you to form a type of activity program that you will do and that you can do, so that when you're done with the program and you go on and live life, that you can actually do these things to sustain your weight loss.
Yes.
Right? And I think that that's super important. And we're still figuring those things out with you because you've had some recent flares and some recent issues. And so now and a lot of it's you figuring some of those things out on how to do it and what's going to work for you.
Right.
So that's the other point I love to make at this point. In other words, patients need to be engaged. And if they're engaged, we can get them where they need to go. But that you have to come willing to do, I think, I wouldn't say the work. I'd say you have to just put forth the effort. If your head is in the game, I'll get you there.
Yeah, absolutely.
So that's what I'm proud of. And I'm also proud of, as you know, my staff. My staff is wonderful. They've been with me for a long time.
They're great too. It's a family package.
It really is. So what else about the program did you find that was unique? So we talked a little bit about the food and your ability to create some of those things. We talked a little bit about how the exercise is not necessarily mandatory. What else helped you get to where you wanted to be?
So the videos were surprisingly helpful.
Okay.
I don't know why that was surprising, but it was. They were surprisingly helpful. The in-body stuff I think is amazing, and that's that whole like dealing with your body.
Right.
Like what's, where are you at? What do you need to figure out? And then of course the convenience and the flexibility. Can't beat that. That's awesome.
All right, so let's talk. Let's explain to them what the in-body scale is. So the in-body scale is a way for me not just to measure your weight, but it's a way for me to know your skeletal muscle mass and your body fat mass. That is integral to understanding how your body is really reacting to the program. I do that every 4 weeks, and I will make adjustments to the program based upon what I see. So for example, if you're losing too much muscle mass, I need to address your ability to do some more physical activity or change shakes so that I can change results. And so that's a part of customization of what we do in the program. What I try to emphasize, as you know, I tell everybody this: if I want you to lose weight, I will send you to Ethiopia or I'll cut your arm off. That's how you lose weight. I'm not interested in weight loss. I'm really interested in fat loss.
Right.
So the key to the program is we will promise you 75-25. As you know, 75% of your weight loss will come from fat. 25 will come from muscle. But to be honest with you, it's almost always 90-10. So 90% of the time, 90% of your weight loss, will come from fat, and 10% will come from muscle. Sometimes there's an ebb and flow until I can kind of even everything out. And you followed right into that pattern. So that was perfect. Now, what else besides the in-body you mentioned?
Well, the flexibility, the convenience of it, that was amazing. The videos.
The videos. Okay, thank you. Keep me on track, girl. So the videos were designed by exercise physiologists, dietitians, people who really specialize just in weight loss. And the whole goal of those videos, there's 20 videos, 15 minutes in length, And the Dr. Premack, who's the creator of the program that we're using, he created a program where he understood that a part of that was education. Mm-hmm. And without appropriate education, he felt that your success would be much less. That turned out to be true as he's been doing the program 10 years now, and 50% more weight loss with doing videos. Now, I agree with you. I've watched all the videos, and there's nothing about those videos that go, oh my God, I didn't know that. But it's that constant reinforcement about what you could do, what you should avoid. And I think there's just a lot of support in knowing that other people are battling the exact same thing you're battling. And I think that's really the essence of the program. To know that I'm going to do what I need to do to get you to where you need to go. And we have made tremendous changes through the program for you. And you have taught me probably as much as I've taught you about weight loss and about how you can do these things and how they can be individualized. And the first day you and I met, we go over our do's and don'ts of the program. And I said to you, and I underlined multiple times, you don't have to be perfect to be successful. If you just follow guidelines and follow the 90-10 rule, 90% of the time you are spot on, and 10% of the time, you will be successful. There's this misnomer like, I got it. No. Because when you do that, and that's another thing. So Kenda is probably the one person in the program, because I get asked this all the time, can I eat out? And so tell them about that, because I think that's fascinating.
Yes. I'm not recommending it, but yes, I eat out quite frequently and still was able to lose weight. And what I thought was really cool about that is that I didn't feel deprived when I went out. I didn't feel like I had to, eat like a rabbit. I could, have some good, flavorful protein and, a few appropriate carbs, but it wasn't, but I wasn't eating the worst thing on the menu either, and it's funny how your tastes change.
That's true. That is very true. So let's talk a little bit about that. So what things did you used to maybe crave that you just don't really crave anymore?
Well, I used to love hibachi. And that creamy little sauce they give you? Yeah. Used to live and die by that stuff. But I tried it in an appropriate way on this program, and I was like, not my thing,
It is really very bizarre. I do hear quite a bit. I don't really know, at least, that I don't know what changes physiologically do or happen that would create that. But I do hear that people's tastes change. So I think it's that rule, really need 28 days to change the habit, right? And I think a lot of what we do is just habit. And then once we break away from those habits, like I hardly ever eat bread. I don't do any pasta anymore. And I grew up in North Jersey. There's an Italian restaurant in every corner, and all my best friends were Italian. And I was in Grandma's kitchen every Sunday having all kinds of baked goods and pasta. So for me to do away with that was really a tremendous, I thought in the beginning it was a tremendous sacrifice. But I honestly don't miss any of that anymore. Right. And now my body is much, much happier for it. So I agree. Now, one of the big things that I pride myself on is not just the time you're with me. Right? I know that if you're engaged during the time you're with me, you're going to be fine. But what I want to hear from you is what you think your likelihood of maintaining long-term success will be. That's the key, right?
I don't have any fear associated with that. I feel like it will be no problem because I know what I'm doing, and I feel like one of the things that you've said when we've, been together in the different appointments is, figuring out how to live your real life. Or correct. Something along those lines.
No, correct.
And I thought that was really good. And I feel like, that's what I've learned to do. I live my real life. I go out to eat. I celebrate different occasions, be it, birthdays or whatever. And your tastes change and your priorities change. And it's a whole body type of thing versus just get the weight off, which, like you say, you can lop off an arm and do that. So
see, you did learn stuff.
I did learn stuff. I wanted to keep my arms. So,
all right. Yeah. I think that you've given people some food for thought, if we will say that. And I really have enjoyed our journey. I really have. I think, and I was not kidding when I think that you have taught me as much as I've taught you. And it will help a lot of people along their journey. We treat people. We treat individuals. The support of the staff is the thing I am really excessively proud of. Ashari's been with me for now a good couple of years. As you know, as my medical assistant, she's lost 150 pounds. Lisa, my office manager, has lost a significant amount. I'm not going to tell you how much because she get upset if I do. But she has lost a significant amount of weight, all of which they've sustained. But they understand, and of course, Karen, who is our coordinator of the program, has also lost significant weight and understands how to relate to people. Yeah. We don't want to make people feel as if they're some oddity. We want people to understand that this is a real societal problem. This is not something that they created or caused, but that they can regain control of. Yeah. I know this sounds weird, but I do think that food is an addiction like every other addiction that's out there. And we often don't eat to live, we live to eat. That may be a cultural thing as a Jewish guy, and all my Italian friends out there, probably the same. But I think learning how to eat to live is probably the essence of what I'm trying to get people to do. Not feel deprived, as you said, but understand that they don't have to in order to be successful long term. So if somebody were to come to you and say, hey, do you think that this program is a good program for me? What would you say to them about that in per se?
Well, I've gotten all kinds of comments and questions along the way. People have been very inspired, so that's been nice. And I actually have 2 friends that are currently doing the program. So what would I say? Do it!
I love it. And they are doing very, very well. Interestingly enough, I love this. This is also part of the program which we need to talk about, is that I don't care how old you are and I don't care how young you are. The program works no matter what chronic disease you have. I'll work around that. No matter how young or old you are. We've had patients now 78 years old, 80 years old, 82 years old, all have lost significant weight and all have improved the quality of their life, more importantly, and their health risk for development of cardiovascular disease. They feel great, and they are living their best life. So your 2 ladies are there. They're going to get there very rapidly. I don't know if you talked to them yesterday, but they are very happy. They are doing extremely well. So we thank you for your support. We thank you for being who you are and for doing so well. We're so proud of you. You're like our little poster child. Oh. And
thank
so
you.
We're grateful. Thank you. For Kenda Maloney, I am Dr. Mark Pinsky. You've been watching The Doctor's Corner. This is Dr. Mark Pinsky once again, asking you to forward questions to us, whether regarding this episode or any of our past episodes, at drmarkscorner@gmail.com. Also, don't forget to check us out on our website, pinskywellness.com or pinskyweightloss.com. We look forward to hearing all of your questions, and we'll get back to you as soon as we do. Y'all have a great week.